This is an educational video regarding an ACL avulsion injury in a young male. The fracture is first explored by arthroscopic evaluation, and it is seen that the displacement of the tibial spine is more than 2 mm on a CT scan. On an MRI, we could see that the ACL, the ligament is intact, and we plan to fix this tibial spine. After a diagnostic evaluation, we will take a bite through the ACL substance, and through a lasso we will pass the chia wire. This chia wire will be replaced with help of a perma tape, and this perma tape will help pull the ACL down. So the perma tape is being taken from both sides, and now another lasso will be taken from the same direction, and another perma tape will be passed through. This lasso loop that will be passed will be slightly below the previous level that has been taken. The first suture is parked in the working portal, and now this lasso is again passed from the same side just below the first bite. We will make sure that the fracture is not more displaced while we try and take this bite. These bites will be taken only once, and they disturb the intratendinous, intraligamentous portion of the ACL, and they mar the quality of the substance of the ACL. So this bite now will be changed again with a perma tape, and this perma tape will be passed. So now we have two perma tapes of different colors, one a tiger and one a blue thread, passing through the ACL. These both perma tapes will now be taken to both sides. So we are drilling on the medial side first, and at the base of the fracture we have created a tunnel. This beath pin will now be replaced with a 4 mm through and through reaming with help of a cannulated reamer. This cannulated reamer is empty from the mid, from the center, the core, and through the core. After taking out this needle which has been passed to make the first pass through the crater, we will pass the chia wire through the reamer, and this chia wire will be taken from both sides in the similar fashion. Once this reamer is passed inside and the chia wire is in, the ice tongs will be used to take the perma tape of both colors, that is the tiger and the blue one in nature, to pass across on both sides in a crisscross fashion. Passing these tapes in a crisscross fashion ensures that the pull is right at the base and the pull is even. Before that, we tie both the tapes together over an endo button. The most common mistake that has been seen to be done is that these suture lassos are passed, and through these fiber tapes or these perma tapes, when these are tied outside, it is usually seen that the fracture of the tibial spine does not reduce itself. The fracture of the tibial spine is often seen to be elevated anteriorly. So whenever we see these post-op reductions, they are quite different from what have been seen arthroscopically. Now we can see that the perma tapes have been passed in a crisscross fashion. We'll make another tunnel on the opposite side as previously done, and we will pass the perma tape through the cannulated chia wire, and this chia wire will replace by the perma tape as well as the blue tiger as well as the blue fiber tape. So once this has been done and it has been passed in crisscross fashion, we have an even pressure on the base or the tibial stump of the ACL. Now a compression is very important for healing of this ACL fracture. So this ACL ligament fracture or tibial spine avulsion fracture needs to be compressed properly so that it can heal well. Most patients have been seen to have a residual deformity on the x-rays, although being on the non-weight bearing area of the joint, it does not hamper in the functional rehabilitation and recovery of the patient. But for achieving ideal x-rays, it is always advised that the last wire that is passed through the fracture, which will be shown later in this video, be done and the threads are tied over the endo button. So now in a crisscross fashion, we can see that the ACL has been tied with both perma tapes or fiber tapes and it has been compressed. Now a third bite will be taken with the lasso in the similar direction, which will be the deepest bite in the portion which is closest to the tibial stump. Now this bite will be replaced with an orthocord. An orthocord or a fiber wire is very helpful in compression and stopping the forward anterior elevation of the bony fragment. We are using this drill and a cannulated drill over the beath pin to again pass a chia wire inside the joint. So once this chia wire is passed inside the joint, use of this orthocord is basically made to make this fragment of the bone sit completely on the fracture site. So once the fracture crater is healed, this permatape or this orthocord is of no use after 3 to 6 months of the surgery, as the ACL stump or the bony stump heals itself. So minimal use of implants and minimal use of anything inside the joint is always recommended. Now we have passed the orthocord, and this orthocord will now be tied outside on an endo button, and this will make the fragment sit over the crater of the fracture. It is very important for arthroscopic surgeons to learn that suture management is very important. It is advised for beginners to use passport cannulas or cannulas as such to pass these wires so as to prevent any soft tissue entanglement while you are passing these sutures again and again. All these sutures at reduction is seen post the procedure, and it is always advised to look at the ACL in full extension. In case that there is malreduction, we can notice that the ACL will not be able to sit at home and you will not be able to achieve full extension. Here the results were excellent post his recovery. It is imperative to have compression at fracture site to achieve good results in such cases.